I've listened very carefully to what the businesses on your programme have to say this morning. I feel their frustration. It is important that we do get a decision that is communicated as quickly as possible. I would have much preferred that had been done quickly. But we're in a 5-party coalition, and that brings challenges with it. I'm going to, as the First Minister, as it is my duty to do, try to continue to work to find a consensus and try to find a proportionate and indeed balanced approach, one which protects our hospitals and one which also allows our families to go out and to have a livelihood. But yet here we are in Northern Ireland. We told people that this would last for 4 weeks. We now have a paper in front of us telling us, no, we need another 2 weeks. And I think the important thing to say to your listeners is, despite the fact that we have asked on many occasions what happens at the end of those 2 weeks, we have been told that there is no certainty. So we could be back here again in 2 weeks' time having the exact same conversation. And that's simply not good enough. What we have to do is to learn to live with the virus, to find a balanced and proportionate way forward, and that is what I am determined to do.
We have heard from you time and time again that it's important to follow the science. It's important to listen to the medical advice. And you were told yesterday at that executive meeting that the Chief Medical Officer believes that any reopening will lead to excess deaths. Is that something that you're really prepared to put up with and prepared to allow to happen?
I think it's very interesting that you've obviously been given a partial report of what happened at the executive. That doesn't surprise me at all, because there are people within the executive who want to get their own spin on what our medical advisors have said. So let me say very clearly, our scientific advisors have been absolutely clear that it is not possible to determine how many people will unfortunately die as a result of actions which the executive takes or doesn't take, either from COVID in the short term, and of course COVID deaths are very public, we hear about them every single day, or indeed deaths from a myriad of other conditions which are caused by restrictions or no restrictions being in place. So assumptions are made around modelling that is given to us. The scientific advisors are absolutely clear that they cannot be definitive in relation to excess deaths that come from one action or another from the executive. So I cannot be clearer in relation to that.
Well, when you say they can't be definitive, they have made clear to you that there will be excess deaths if there is reopening. They did make that very clear.
But there are also excess deaths if we continue with the restrictions or if we take no decisions at all. So let's have the whole picture out in the open. Let's not just have a partial picture out in the open. And that's what concerns me about this whole discussion. We have the health paper, and I think everybody knows, listening to this programme, that I have the utmost respect for our medical advisors. I have listened to them. I have worked with them. I will continue to work with them. But yesterday we also had a paper from the Economy Minister which set out the devastating impact of this past 4 weeks that we have had on the Northern Ireland economy. The Northern Ireland economy has lost £400 million. Now, some of your listeners may say, oh, surely this is about lives and the economy. Actually, if people do not have a job, they go into poverty. Poverty has its own health outcomes. And I'm afraid to say that we are facing a mental health tsunami in relation to the pressure that we are putting on families as they come up to Christmas in relation to all of this. So, as the First Minister, I have to take all of these considerations into account. It is not my place to just look at one part of the equation. I have to look at the entire equation.
Yeah.
So let's not get into a situation where this is health against the economy. It is not health against the economy. What we need to find is a proportionate and balanced way forward, a system where we live with the presence of the virus, but people continue to live their lives, to earn a living, and to move about in society.
Literally inside the executive, it is health versus the economy. It's the health minister against the economy minister. They are putting out two very different ideas about what should happen, and that is because they are concerned about their own departments. They're concerned about the impact on what they look after, and I have to defend both the health and the economy minister, because that is not
and I mean, the health minister is not in my party, but let me defend him very clearly. He understands that there are economic consequences, and he is concerned about that for the people of Northern Ireland. Likewise, the economy minister understands that there are health implications, and she is very concerned and has mentioned on many occasions, for example, the fact that we are seeing a huge amount of COVID cases now happening in our care homes. Last month we had 46 outbreaks in care homes. This month we have 146 outbreaks in our care homes. That didn't happen in hospitality. That didn't happen in a hairdresser's or a beautician. So let us be clever and let us be targeted about how we deal with COVID-19. None of us are saying that we shouldn't be dealing with the issue of COVID-19. But we have to come to a proportionate and balanced way forward, and one that deals with all of the issues in front of us. And let me say this as well, Chris. The Deputy First Minister went out onto one of your sister programmes on Sunday morning. She advocated a wide range of relaxation. She said that she was proposing that to the executive. And I think it's a matter for Sinn Féin as to why they now are in a situation, despite the fact that there has been no change in the medical advice, none whatsoever, as to why they are now in a completely different scenario where they're saying, do you know what, let us keep hairdressers and beauticians closed, let us keep coffee shops on our high streets closed and roll it over for another 2 weeks.
Well, I'm not sure they would say that they have changed their position.
In the knowledge that in 2 weeks' time, things will not have changed and we will be back in exactly the same position, faced with exactly the same decisions.
Well, I'm not sure that they would say that their positions change. In fact, Michelle O'Neill's tweeting that we follow the medical advice, and they are, I would suspect, say that their scientific advisors, they are listening to those who are saying that any reopening would lead to excess deaths, and that is why they are specifically concerned.
Any other decisions will lead to excess deaths as well. The point I'm making to you, it's not a partial situation about excess deaths. That's what makes these decisions hugely difficult for all of us. And, I'm not going to get into a situation where I say that dying of COVID is more important than dying of mental health issues or dying of cancer or dying of stroke situations or dying of diabetes complications. I am not going to get into that situation. What we need to get to is dealing with these things in a grown-up way and in a way that recognises that there are no easy answers to any of this, but we should work to find a proportionate and balanced way forward, reaching consensus that we can all live with. Because, of course, if the DUP were in a situation where we were a one-party government, this would be a completely different way of dealing with things. But I have to accept the reality that as First Minister, it's incumbent upon me to try and reach a consensus across those five parties. And that's what I intend to do.
And that's what I want to talk about, because basically, if you can't reach a consensus, there is this danger of just complete deadlock, that nothing happens. And if that happens, it does mean that the restrictions could potentially lapse at midnight tomorrow night. Are you prepared to let that happen? Are you prepared to have restrictions lapse, which means that pubs, restaurants, everything can reopen again?
Well, look, let me first of all say that we were told initially, and I've already said this on your programme, that we would have these restrictions in place for 4 weeks. That is clearly not the situation now. That has changed. And I want to say to all those that trusted us in making those decisions that I am very sorry that we have found ourselves in this situation where we're asking for another 2 weeks, because in another 2 weeks we might be asking for a further 2 weeks. And I think that is unsustainable. We have to find a way forward that gives certainty to businesses so that they can continue with their lives. And we do that by living with the virus, by having a COVID-secure situation, working with local government, working with our different sectors, making sure that we have a good test, trace, isolate strategy, looking forward, of course, to the vaccine and recognising that we do have better treatment than the first wave. And because of that better treatment, actually, we see people staying longer in our hospitals, and we see people coming out whereas they may have passed away in the first wave. So I think it's important that we say all of those things and that we try to move forward together. That's my focus, trying to move everybody forward together. And it disappoints me greatly that we haven't been able to get to a situation where we can have a decision.